Good morning, everyone. We are just waiting for Kathy to join us before we get started, so it'll be another couple minutes. While we wait for Kathy, I'm going to put the breakout room icebreaker question in the chat so everyone can start thinking about that for our meet and greet breakout rooms. Hi, Kathy.
Good morning. Sorry to be a little late. It was the first time I used Zoom this year and it didn't want to let me in right away. I had to figure out what my password was. Um, Happy New Year, everyone. Welcome. And uh I still see a few folks joining. We'll give folks maybe like 30 more seconds. While we're doing that, I know some of you have already started to do this, but we can go ahead and put our names, pronouns, organization, or why you're here in the chat. And then we're gonna break into some minute to do breakout room meet and greets like we've been doing the last several months. And just a reminder for folks who maybe don't know who I am Kathy Killering Del Rio. I use she, her pronouns. I'm the Advocacy and Programs Director at Mean Equal Justice, and I chair the MAC. I did also want to share good news, though I didn't say this to Adam in advance, but Adam has happily volunteered to be a vice chair for the MAC, which, as many of you know, we've been looking for a long time. And he had such a good experience facilitating in November that he was willing to take it on. So thank you so much, Adam. We really appreciate it. I really appreciate it.
Thanks, Kathy. Happy to help and appreciate working with this group. It's always such a good one.
Thank you. Okay, so Kayla, are you able to do, I know you said you got this, so can you set up the get the breakout room started for our meet and greets?
Yes, absolutely. I am about to press go, so we should see those open up in just a moment. I did put it in the chat, but now it is way far at the beginning of the chat. The icebreaker question for you all in the breakouts today is, what is a ritual or a tradition that brings you joy when welcoming a new year? And I will go ahead and break us out into groups. There should be about 3 or 4 people in each group. Jillian, it's nice to see your name on my screen again. It's been a while.
Did you say Jillian?
Yeah.
Yeah, you too. The way the invites changed, I wasn't getting them. So I was like, or if I was getting them the day before, so I didn't know. And then like I just got this yesterday. So I had to change my whole schedule to be here.
I'm sorry that happened. I'm glad you were able to make it today. And feel free to reach out to me after this if you're still having trouble
I
getting
think
connected.
usually it just used to be that it was in your schedule, like as a
Yeah.
recurring invite. And I think you guys changed it, like you had to apply or something. So for some reason, I don't get them anymore until the day before I get the agenda. I was like, oh no.
I should be able to help you with that. If
Perfect.
you want to connect after, you
Yes.
should still be able to have it on your calendar after you
Awesome.
register that one time.
That'll be great.
Yeah. Did you want to join your breakout room to meet and greet?
Sure.
Okay,
Yeah.
I think I can move you there.
Have a good day, Kayla.
You too.
I had a button to click and that disappeared.
Okay, let me see. We'll try that.
Got it. Thank you.
Perfect. No problem.
Hi, Melissa. Welcome. The MAC has broken into individual breakout groups, and I'll see if there's a way to loop you into yours. But thanks for joining us.
Thank you.
Thank you, Lisa. I should be able to assign you, Melissa, and Kathy to breakout rooms.
It's asking if I want to join room 5. Should I hit yes?
Yes, perfect. Hey, Vanessa. We are just doing meet and greet breakout rooms.
Oh, okay.
We have about 2 minutes left. I'll leave it up to you, Kathy and Vanessa, if you want me to pop you into a random room or if you would rather just hang out here since it's almost over.
I'll just hang out here. I'm still kind of stuffy. I was sick over the last, yeah. Oh, Kat is inviting me to join room 12.
Oh, okay. Feel free to do whatever makes you comfortable. You can stay here. That's fine. I'll be calling them back. I'm going to send a 2-minute warning right now.
I'll stay put then.
I hope you're feeling better.
Yeah.
Like we have about half of our folks back. All right. Looks like everyone's back with us.
Awesome. Thank you for setting that up, Kayla. And I hope everyone had a good chance to connect. So next up on our agenda for today are updates from MaineCare. So I'm going to pass it over to Michelle Probert. Welcome, Michelle.
Thanks, Kathy. My name is Michelle Probert. As Kathy said, I use she, her pronouns. I'm the director for MaineCare, and a very happy new year to everybody. It's nice to see you here this morning. And I also want to give a shout out to Adam for volunteering to co-chair. Kathy, I don't even remember how long we've had that ask out there. So I'm sure it must be a big relief for you. And we really appreciate it, Adam. And you did a fantastic job chairing the last meeting. I don't remember if it was our last meeting, but anyway, it was recently. So thank you for that. All right, let's see. I'm going to go through updates. So first, I'll just share that as of January 1, we have implemented 1% cost of living adjustments to a number of MaineCare services. That was as directed by the legislature. And maybe Kayla or somebody from comms could link or share the link to the e-message in the chat that details what those sections of policy are that received that increase. Also, wanted to flag that yesterday the department released a blog about the fact that we have entered year 2 of nursing facility rate reform. We can share that blog link in the chat as well. There will be a lot more detail in that, but I'll just remind folks that with the implementation of nursing facility reform last January, we are basically in a 3-year transition period where we are going from a system where there was a fair amount of variation to a system that is really consistent across all nursing facilities, but given that different facilities were in different places in terms of reimbursement and potential impact, we have a kind of guardrail or glide path approach to get everyone to the same place after those 3 years in terms of per diem reimbursement amounts, and we're also appropriated funds from the legislature to help ease that transition. So we've completed year 1 of the 3-year transition. We're entering year 2. I did want to share exciting news that over 97% of our nursing facilities completed the quality improvement initiatives in 2025. Calendar year 2025, and all facilities began receiving scorecards regarding available performance measures. The participation in those quality improvement initiatives in year 1 is tied to bonus pool payments. And in year 2, we're going to start the transition so that those quality payments will be increasingly tied to not to performance on actual outcomes versus just participation in activities. So that is that's a really big transition and a big deal, and appreciate the really strong performance and interest in how we call it the Quest initiative. And ODES has done a great job leading that, and LitCop, Long-Term Care Ombudsman Program, I think I got that acronym right, has also been very important in that program as well, and that technical support is going to continue. So I think things after year 1 of nursing facility reform, I think that I speak broadly when I say that it went pretty smoothly, and there are big changes and big transitions, and we still need to do significant analysis to figure out what the actual impact has been, and to make sure that we are spending the allocated transition funds fund amounts in an appropriate manner. And so lots of work still underway, but it feels good to be through the first year of that process. On a pretty different note, I also wanted to talk a little bit about provider enrollment. We were in a pretty painful place a couple of years ago in terms of our provider enrollment processing time and case inventory. And I'm very happy to share that with a lot of strong work by the MaineCare team and partnership with our vendor Gainwell, as well as input from the provider community that we have acted on, we have seen very significant improvement. So in November 2023, the average turnaround time when providers needed to update their enrollment information was 64 days. And 2 years later, this past November 2025, we were down to 12.6 days. So that is a very, very big difference. Again, this is about provider enrollment, but that, as many of you already appreciate, is directly connected to members being able to access care in a timely manner and sometimes at all. And so making sure that that access is available in a timely manner is very, very important. Okay, next, you may have heard in the news over the holidays that the Rural Health Transformation Program, which was part of the budget reconciliation bill from last summer, also sometimes known as HR1, also known as Big Beautiful Bill or Working Families Tax Cut Act. There's lots of different names, but the Rural Health Transformation Program was a part of that law that puts some money back into the broader system in the context of the much broader cuts to Medicaid that law involved. So all states were asked to assume a $200 million a year budget for their proposals. By law, CMS had to issue award amounts by the end of the calendar year. And they squeaked under the wire to do that. And Maine received a $190 million a year award. And so fairly close to the initial budget that we had put forward. We are doing the work right now to actually true up our budget proposal that we had submitted previously with the award amount that we have received, and we need to submit that for approval close to the end of this month. This is a very important opportunity overall, but I'll say that the application process was extremely aggressive for all states. And again, it was really a placeholder budget amount. And so this opportunity we have now is really important to do our due diligence to make sure that we can perform and execute the $190 million in the year of our proposal. And so really trying to think about all the really fun stuff on contracting and RFPs and timelines and logistics and making sure that we can succeed with our proposal and that we are going to do all the initiatives that we set forth in our application, but there will need to be some level of changes to bring it down 10 million, and also just to make sure that that we're able to succeed with our proposal. Because as a reminder, this grant is different from some other grants in that there's a limited period for you to use the funds, and if you don't use them, there are no cost extensions. The money gets taken back. And so we do not want to lose the funding that we've been awarded. And so making sure that that we can perform in accordance with our plan is super important. So there will be more to come. And once we have that final budget, then we will be sharing that more broadly. those are my main updates. I don't know if we have time for questions, so I'll defer to Kathy on that.
Yeah, we do. I see Adam's hand, but also there was a question in the chat from Amy Fair wondering if the nursing facility rate reform includes home health agencies, residential care facilities, etc., or only nursing homes.
Yes, so the nursing facility reform that was implemented starting last January just involves nursing facilities. We have done some work on res care facilities, but are not in a place with a full proposal for how to reform that reimbursement. And then in terms of home health, we are getting closer to being able to present recommendations from a quite broad rate determination that looked at a whole range of really home and community-based clinical and care coordination services, et cetera.
Thank you. Adam?
Thanks, Kathy, and thank you, Michelle, for all the updates. And just want to underscore too, before I ask my question, just how much of a win I feel like this is for Maine and the state. I mean, I can't underscore enough. I mean, there's so many states that didn't even come close to their full $200 million project amount. So the fact that Maine is getting like 190 of 2 million is just really, really outstanding. I think speaks to a lot of the work that partners in the state did on this. So huge kudos on that. I know as part of this, there's a stakeholder advisory committee that's meant to sort of help the department through implementation, especially in early days. Wondering if you have any updates on timeline of when the state might be looking at bringing those folks together on bringing an advisory committee for the Rural Health Transformation Program grant?
Kayla, I'm going to look to you on timing of input of the back on RHTP. I know that there's been some thinking on that.
Yeah, so our beneficiary advisory committee was able to provide input before we submitted the application. So we were able to take over half their meeting in October, very last minute, but they were very gracious and we put those recommendations forward. There has not been any discussion yet about what the next stages of input looks like. I'm anticipating that there's a level of involvement from our main care advisory committees, but I haven't gotten any details on how or when.
That's helpful, Kayla. And just to be clear too, maybe I misspoke too. I think the grant had mentioned like a specific new advisory committee for the Rural Health Transformation Program with like certain stakeholders from certain systems and industries, consumers, things like that. It's okay if there you don't have an answer now. I just wanted to follow up on that just to see if there was like any timing on that.
I am not aware of timing on that specifically, Adam, yet. What I can say is at the moment, we're really focused on being able to get core staff, positions posted and then hired, because we'll be able to make a lot more progress once we have people who are dedicated to the work. So we're really, at the moment, we're really like trying to hire up so that we have the team to do the work. And we're also obviously needing to finalize the budget plan for CMS approval by the end of this month so we can start to have those dollars flowing. But absolutely the, advisory structure, et cetera, is going to be an important piece of the work that the leadership team that will come on board will do as well. So we will keep you updated.
Thank you. And there is one other question, which may be a question that's more for OFI, but curiosity around any updates on implementation or mitigation efforts for Medicaid work requirements, which I know are still months away, but we are in the year now.
Sure. My general update, and then I think Ian is on the road, but I'll invite Jessica Drenning to weigh in if she has anything to add. We are setting up inter-office structure and working on, work plans and having discussions with vendors to basically make sure that we are tracking everything that needs to happen. and getting appropriate support to do that. So that is a very general update, but that's basically where we are. I am forgetting timing of our last MAC with CMS guidance that came out. I think it was in November, or it might have officially, they may have like leaked it at a National Association of Medicaid Director meeting in November. It might have come out in December. I'm not totally sure of the timing, but there was, CMS shared some guidance on how they're defining, drawing a blank on the term that they use, medical frailty. Is that the right term? I think I see nods. Thank you, everybody. So they put out some more information on how they're defining medical frailty and expectations around the need for states to verify that information and to have a medical screening process. So I won't go into too much detail there right now because I don't think we have time, but if that's something we want to circle back on, we can. But we're basically still in the process of trying to figure out how and on what timeline we achieve all this, are able to come into compliance with these requirements.
Thank you. And that seems like a good transition to our OFI updates. And as you said, Ian's not here, but Jessica, you are, and I also see Vanessa, if one of you wants to share an update.
I think that Ian had planned to maybe be here for part of this update, so I don't have something prepared. However, he was traveling, so that could be part of the delay. And I will appreciate Michelle's comments on the topic previously and can confirm that all of us are working towards implementation in the best way that we can, making sure that we can get things in place and timely. We are definitely prioritizing it in our workflow and just making sure that we're able to kind of meet the requirements as they come with enough heads up for folks to let them know what we need from them as well. And I don't have like a broader update again, because I think Ian was planning to be here. So he might still hop on at some point, might still get him. So maybe pause on that. Thanks.
Great, thank you. Any other questions for either the folks at Mainkey or the folks at OFI?
Looks like Ian is here, Kathy.
Oh, I didn't see him.
Admitted Ian.
Oh, okay. Welcome, Ian. We were just going to check in on the OFI. I don't see him.
Oh, it looks like it's taking a minute.
Oh, okay. I was like, wait, I'm talking to someone, but I don't actually think they're here. Okay. We'll just wait a second. And just a reminder for anyone who's a MAC member or alternate, if you haven't had a chance yet to introduce yourself in the chat, please do so to make sure that Lisa sees you so your attendance gets captured. And guests are welcome to introduce themselves as well. Mitchell.
Sorry, I didn't mean to do that. I've had some weird issues with my computer, so it's
No worries. I do see Ian now. Ian, we had just checked in with Jessica about any updates from OFI, and she said she thought you might have some if you were able to join.
Sure. Yeah, good morning. Thanks for your patience. I'm up here in Fort Kent today. So I wanted to share a couple of quick updates with folks about where things are at with OFI. Last week in particular, we had a pretty rough week on the phone queue. So if you have been trying to reach us or if you've been talking to Members, last week was a particularly challenging week for both MaineCare only related calls and for SNAP and TANF calls too. That was caused by several days of office closure, right back to back with each other, and then a technology issue that occurred on Monday morning as soon as we got back. And so we saw kind of consistent peak demand throughout last week, but it is beginning to return closer to regular expectations here. We're still processing through backlogs of applications with open enrollment referrals having been a priority for the past several months. I think we're through most of those determinations, but if there's people that are still between OFI and OHIM for like marketplace versus MaineCare coverage, they should reach out to us by phone if they have questions. We are close to being done with all of those, if not already done. But that's definitely been a priority for the past couple of months. And we'll begin to see sort of a return to normal processing expectations in the coming months, as we sort of have that seasonal increase to volume now in the past. A couple other things for this year, we're still, in terms of everything with community engagement requirements for MaineCare, we're still in the active planning process for that. So we expect to have more news to share, throughout the spring, and particularly as we get into the summer about what people should expect for that. But we're now pretty active in the planning efforts for that, and there'll be a lot of communication again, in particular as we approach the summer about what people should expect for that. And we did have some recent reports of automated phishing campaigns for people that have EBT cards. We're going to be sending out some communication this week and some social media posts about that as we approach SNAP issuance week. But just wanted to sort of do the standard reminder that people should never give their EBT number or PIN to anybody over the phone, or anybody who requests it really at any time. There's no reason that anybody will request it. We will never request that number. So there's never a time where you should take a phone call and provide somebody an EBT number. And, if you have to call the card servicing company, they may need to get the number, but you can always call them. They're not going to call you and ask for that number. So those are just a couple of quick things that I wanted to share. Again, the call center, I didn't get the numbers in front of me right now for where they're at today, but just last week was a particularly challenging week, and we are beginning to see a return to regular expectations here. So I just wanted to pass that along. And then the last thing I also wanted to share is that we've had persistent challenges with application timeliness over the past 6 months. And we are going to be onboarding some temporary staff to assist with that effort, similar to what we had in place during the unwinding effort, a smaller contingent. But we are going to see some increased capacity at OFI here beginning next month, with some of the staff that we had previously hired that are already trained, and then by the end of March for the folks that are brand new. But we had about 40 temporary staff start here this week, so that we can more consistently address those challenges during the year. And as we begin to shift some resources on our end from sort of like standard processing activities and into some more SNAP payment error rate sort of accuracy related projects. So we want to make sure that we continue to improve timeliness, even as we also make to look at improvements on accuracy. So happy to answer any questions that folks have. Sorry, they don't have the numbers in front of me. I was hoping to get here a little earlier and be able to get those for you. But I will put them in the chat if I get them shortly.
Thanks, Ian. I do see a question in the chat from Rachel saying that My Main Connection has been promoting for weird renewals even after they've been done. Rachel, do you want to say anything more about that?
Yeah, so like November 29th, it popped up saying that I needed to do my main care renewal by November 30th. And it keeps just popping up randomly on the 29th of every month, prompting me to do it by the 30th, even though it's already been done.
That seems strange.
I can confirm that that's not just a glitch for her. My children are enrolled in main care, and I keep getting that as well.
I was gonna say, as far as Maine State Parent Ambassadors, it's happening to just about all 165 of us in alumni. So I figured I'd just mention it while I was here today to see if anyone had told you that was an issue or if we're all just looking the other way.
When did that start happening?
In November.
Okay.
And that's about the time you guys started having such high call volume that no one can get through the phone.
Okay. We'll definitely look into that. Vanessa, see you here, and Jess, is there any other information that'd be helpful to get in this meeting to help look into this? As far as I know, I have not heard that issue reported yet. That doesn't mean it hasn't been reported at all, but that's the first I've heard of it.
Yeah, I have a follow-up question, if you don't mind. Was the renewal processed? Did you receive a notice of decision letter?
Yes.
So
we received notice of decision and everything before it even prompted me to do the renewal the 29th of October. And then I got through to somebody very beginning of December who was like, yep, it's here. And she manually processed it while I was on the phone.
So it sounds like you might have had multiple individuals, like maybe someone went through what we call a passive renewal process, and then like the remainder of the individuals needed to go through a regular renewal process.
It's still prompting even after I went through it on the phone, though.
Yeah, then that's if I put my email address in the chat, would you be able to connect? Can we connect on this?
Yeah,
just so I can
absolutely
work with our tech team because we'd like to dig into this to get it fixed.
Yeah, absolutely. And I can send screenshots over too.
That would be awesome. Thank you, Rachel.
And would it be helpful for other Rachel Collmore to also connect? Because she said it's happening with her kids too.
Yes, that would be helpful. And I do have Rachel's contact information.
Okay.
Collmore.
Yes.
Well, thank you so much for sharing that issue. Sorry that we have apparently not heard of it as of right now or before now, but appreciate the chance to hear about that and confirm pretty quickly that it appears to be something impacting lots of households. So we will definitely start looking into that today and provide an update when we can back to the MAC about when we are able to fix that or whatever the root cause was. I know that we had lots of manual changes happening in November to renewal processes associated with the government shutdown for SNAP. So it's pure speculation if that's impacting something else unexpectedly. But we will definitely look into it and try and figure out both what is happening here and then kind of more importantly, how soon you should expect that to be fixed.
Thank you. Okay, with that, we can move over to updates from the back, and I will pass it over to you, Rhonda.
Thank you. I just wanted to comment also on what everybody was just saying. I had a similar letter, but it informed me, and it was like September, October, and I always get one every year to say, my grandson that I'm raising qualifies for main care. But it also said that I made a certain salary last year from Intermed, and yet I had been retired for 2 years. So I called, and I was on Social Security. So I called the office, main care, got a really helpful person who said, I see your paperwork here, but it never got put into the computer. So she put it through, and then she asked me some questions about my Social Security and said, do you know that you qualify for QMB? I said, never even heard of such a thing. I've been in healthcare for 45 years, but had no idea. She was very, very helpful. So there was definitely some glitches in paperwork and computer action. I fill it out every year, and I hadn't worked at Intermed for 2 years, and why it said I worked at Intermed, I'm not sure. So I think there's a series of things that went on. Hopefully we're on the right track now. Reporting out on back, our meeting was December 2nd. We had 17 people present. One of our back members was able to come back into the program with us, which was great. We also, it was our last time with Valerie, the facilitator. She had to let us know that she was gone, moving on to something else. And we're going to definitely miss her. And I'm not alone on that. I also want to thank Sana and Kat for helping me pull together what this requirement was for me to talk to you about our last back meeting. They were very, very helpful. So anybody else that takes a turn at it, just know that you can reach out to them. So just to mention, one of the things that took place was that the members continue to add website reviews. The Padlet tool is amazing. Not everybody has played with it or participated in it, but it really seems like a great tool for between meetings to be able to bring up things, issues, concerns, whatever. So if you haven't partaken in that, please consider doing so. It's a great way of communicating between those meetings. Kayla Sargent shared at our back meeting about the RHTP, which was just mentioned earlier, and gave us information and said we were waiting to hear what we qualified for. And as mentioned, we did qualify. It's actually over 190 million, which is wonderful. Also, back members received a letter from Michelle from OMS, the director there, thanking them for their input and how it helped incorporate into the application process. So that was a really nice gesture. Jessica Drenning from OFI and Sarah Fisher from OMS presented to back about the Katie Beckett program. Again, having worked in healthcare for 45 years, I was aware of it, but it was amazing to hear the detail, the support, and also review the application process. They gave us the link in the website to review the application process and better understand who qualifies, how, and how you fill out the paperwork. So that was very, very helpful. We also have the minutes are available. I'm sure that's on a link somewhere if anybody wanted to see, all of the detail notes taken. And our next meeting is February 3rd, and it is from 11 to 1. And hopefully, I'll end with, hopefully people do their one-on-one connection with Sana and Kat. They find it very helpful. I found it very helpful, better understanding what we're doing, why we're doing it, how we're doing it. So if you haven't done the one-on-one, please consider doing that. It will be helpful to the whole program. Any questions, thoughts?
Thank you so much. We love hearing those updates. and also appreciation in the chat. um, okay, so next up is closing the loop on past breakout room topics, and that's Shannon and Kayla.
Shannon, we didn't discuss who was going to go first. Do you want me to go?
I don't mind going first. I can jump in and say my piece. So in one of the past breakout sessions, we discussed discharging members. So this is asking a member to leave a practice. We talked about some reasons why providers might discharge members, such as no-shows, for example, no-shows, no calls, and then some reasons why a member might no-show or no call, specifically no-show, like they might not have transportation, or maybe they need some extra support, like case management services. So a couple of things came out, tangible things came out of that meeting. We have a no-show flyer that's educational flyer for members that providers can print off, download and print off to hang up or to have in their office. And it explains, that if you can't make an appointment, make sure that you call your provider and let them know that you can't make it and that kind of thing. And then we also have worked with the Office of Behavioral Health, Office of Children and Family Services, Office of Aging and Disability Services, to come up with a document that explains how to refer a patient for case management services. So it explains who's eligible for the service, how to refer them, and then which office coordinates that service. And it's based on basically a member's age and also what diagnosis they may have. So that document is in the works. We're working on finalizing it this week. I hope to have it posted next week, and I can share that link out to all of you. And I think that's all for the update about discharging members. And I'll drop the link to the no-show flyer in the chat.
Thanks, Shannon. And I will, before I jump into my closing the loop statement, I will say this practice of bringing back old breakout room topics as an agenda item is something that we're trying out to make sure that we complete all of the follow-ups and have closed the loop on anything that deserves special attention or discussion and engagement in a breakout session. There will be a survey at the end of this meeting, just like we've been doing lately with all of our meetings. And that's a good place to offer feedback on this particular practice, or if you have any other ideas for how we could be closing the loop on breakout sessions. I am reporting back on the last meeting that you all had in November, discussing some of the access rule requirements. There was a breakout room to discuss the annual report, and there was a breakout room to discuss hosting public meetings. I will say today we are officially in compliance for the minimum that we need to do to consider the MAC a public meeting. I know we at the OMS side of things, and I know the MAC discussion at your last meeting displayed that we all have an interest in doing that better. So not just meeting the bare minimum requirements for engagement in the public meetings. You all had some great ideas at the last meeting around planning for themed topics for the breakout rooms that are particular for that public setting, creating a hybrid environment, so having both in-person and virtual attendees, working toward a mid-spring timeline for that first jump into a very different way of hosting a public meeting, inviting members to give opening remarks, and then being really intentional about the way we invite public engagement and public comment for those meetings, because we're anticipating broader audience than we might normally have. Those are all great ideas, and there will be a breakout room today that Kathy will be facilitating to talk a little bit more about how do we make those ideas happen, and what do you all need from the state to support you in that. The second topic was the annual report. The first report is due to be finalized and posted on our website by July 9th of 2026. So that's something to keep in mind. I think making progress on that will be important. That will also be addressed in the breakout room today. The meeting notes from the last meeting didn't have as much tangible action items or next steps to support the annual report. So I would recommend maybe a little more focus on that today if there's time. But that is the closing of the loop on those topics. Any questions or comments? I'm going to put a link to the meeting notes from the last meeting. You can find those breakout room notes at the top of page 3. That's where those begin.
Thank you both. Oh, Laura?
Good morning, Laura Cordes from Maxby, and thank you, Kayla, and all the members for thinking about the follow-up on those groups. My question is related to the last meeting, but not those specific breakout groups. We adopted new bylaws, and I was asked and didn't know and wondered if there was an update on, the bylaws reconstitute the MAC, both with a listing of new, I would say similar, but kind of a new set of members and application process. And I wondered about the timing of reconstituting the membership of the MAC. Thanks.
That is a good question, Laura. And I am realizing that we did talk about this in the fall, but I don't have my notes in front of me of where we landed, and my brain is like not there. Kayla, do you remember what we decided?
Yeah, so we had discussed with the access rule, there are some new like term limit requirements and more specificity around that. We had discussed, and I don't think that this was voted on, so there could be next steps to take. And Kathy, feel free if this jogs your memory and you want to add anything. But we had discussed that folks who are current members of the MAC would have kind of 2 options. The term would have ended under the old Constitution this December. So we would have a complete turnover in the MAC if we were still going by that term. So we wanted to offer folks that you could step away from your position and then that spot would open up and we would do an application process for that spot up to you. That would be a natural thing to do and totally acceptable, but an alternative option to try to maintain some of our membership and some just like historical information and practices is that the new term would have started with the access rule. So this past July, when we integrated the back, drafted the bylaws, and so we would have a separate kind of parallel term length that started this past July, that folks could remain in their seat under that term description. And I wasn't prepared to speak to this, so if there's anything that needs clarity
as you spoke, Kayla, that is what I remembered us discussing. And then, actually partly because I wasn't here for the November meeting, I don't think we actually shared our thinking with the whole MAC. So thank you for prompting this question, Laura. So I do think if there's anyone who is currently a MAC member or alternate who is like, you know what, I am done. Like, I don't want to commit to a full term beyond what I've already served. Like, please do let us know. And there is always some turnover anyway, because people leave their job or things come up in their lives. But if there is anyone who would like to have your term end, we can do that. And then again, I think we want to make sure we'll have an application process depending on what seat you're in. Like, it could be someone else from the same organization or a similar organization. In some cases, it's more broad than that, right? Like, our clinical seat can be anyone who has those qualifications. So we want to try to maintain the overall balance of the MAC. And I see your hand, Sarah.
Yeah, thank you, Kathy. Sarah Squires. You may have answered my question, which was going to be that there are, like, would the membership apply to the individual themselves or the organization? So Disability Rights Maine or MAXP, CAKE or anything. So would it just be that, like, it would be a different person from DRM who could apply, or would DRM as a whole be like shuttled off into the night?
The way we had talked about it and the way we talked about it when we last reconfigured the MAC was certain seats are representing an organization. So, for example, when Mallory retired, Adam took her spot. In some cases, there are seats that are more individual in terms of, like, again, like there's a clinical representation or back members or individuals. So, and previous to the back, there were, and not recently, but in the past, there had been main care members who were individual members of the MAC. So I think it depends on the seat. Our overall goal is to maintain people with similar expertise. So, and representing similar range of areas. So we tried really hard when we reconfigured the MAC back in 2019 and again in a couple years ago to like get a range of perspectives to be here with us. Kayla?
I just want to add that we, Kathy and I, and the folks at Main Care spent quite a bit of time talking about this exact question. And because of the access rule, we landed on seats not being an organization's seat that they own, but being a seat dedicated to that type of representation. Because the access rule prohibits consecutive terms, if we were to say that an organization is the member holding that seat, they would not be able to serve a consecutive term. So that kind of put a kink in the plan. But I think that where we got to, coming to a place where it's that seat is dedicated to that type of representation, should work.
Yes, thank you for that clarification, Kayla. And as you said that, I realized I misspoke the way I was trying to describe it. So Laura, does that answer your question?
Somewhat, thanks. I
Okay.
appreciate the information.
Yeah. And we can touch on this again. I can send out some notes with following this meeting just to make sure everybody knows that they have the opportunity if they want to step back or if they want to continue. Laura, did you want to say something else? Okay. Okay, well, let's then transition to our next piece, which is and we are exactly on time. The Children's Behavioral Services Settlement Agreement updates, which is coming from Kristen McCauley.
Good morning. I'm Kristen McCauley. I'm the Deputy Director here at the Office of Behavioral Health, and I'm joined by my colleagues Dean Bugaj and Karen Sachs-McLaughlin to provide an update in regard to the Children's Behavioral Health Settlement Agreement. I'm actually going to turn it over to Dean and to Karen to lead the presentation.
Thanks, Kristen. It's possible to be able to share screens. You have a few slides we can walk through. And while we're getting that set up, good morning, everyone. I'm Dean Bugaj, the Associate Director for Children's Behavioral Health Services within the Office of Behavioral Health. All right.
Dean, are you sure? Oh, you're good.
Yeah, I'm just getting the permissions going. Okay, hopefully you should be seeing my screen. It should say CBHS Settlement Agreement Update for the MAC.
Looks good, Dean.
Perfect, great. Well, good morning, everyone. Thanks for the opportunity to chat a little bit about our settlement agreement. And so this morning, we'll talk just through some introductions, which, I'll pass the mic over to Karen in just a moment. And then we'll do a little bit of discussion around the agreement itself, its focus, the future system of care, some of the key things that we're working on. Then Karen will talk about the single assessment and service planning requirements, go through outreach and public education, our engagement committee, and then have some questions. Karen, you want to just quickly introduce yourself and then I'll get into the topics?
Sure. I'm Karen Sachs-McLaughlin. I'm the Principal Settlement Manager working in CBHS to help implement all the aspects of the settlement agreement.
Thank you, Karen. And so really with the settlement agreement and We've been in it a little over a year now. So it was official through the courts on December 20th of 2024. And so we're right around the corner from really a lot of the initial effective dates, being hit, and a lot of work, to come, which, Karen will, kind of speak to. But really the first year has been really about, doing a lot of foundational work within the settlement agreement, understanding the agreement, getting all of the necessary pieces, in place, Karen of which is a big part of the work that we have done, as she helps us, not only is her role, required in the agreement, but then it's really been principal to supporting all of our work, kind of moving forward, and help us organize and develop all of the plans and everything else, kind of going along with this. But the agreement and its focus is intended to build that, really stronger, more coordinated system of care that is really focused on helping children stay home, access the right services and thrive in their communities. So it's a real focus on community-based services. We do have 5 areas of focus within the agreement. So that's the service access and coordination, which will be streamlined to the single assessment and individualized service plan, which we're, kind of calling the coordinated service plan, which Karen will talk about a little bit more momentarily. We're really focused on expansion and enhancement of our community-based services and adding new services like high fidelity wraparound, that intensive, community-based care coordination service that we're doing through behavioral health homes, which is open enroll right now. And then the also focusing on developing a treatment intensive homes, which is a family home in a therapeutic kind of foster care model, but it's open for a youth under any form of guardianship, whether it's state custody or parental guardianship, and has a real focus on supporting the family and supporting the child towards strengthening their bonds and managing behavioral health needs. So all of this work is really intended to kind of bolster our service delivery system, both in the community base and then in services that are within a family home. And this isn't to take away from any of our other important services, as well, thinking about, the continuum of care and residential services, developing our psychiatric residential treatment facility. Those are all very important, to our service delivery system. The settlement agreement, kind of specifically focuses on enhancing community-based services and family homes. There's workforce and development and training aspect to the agreement, and so enhancing the provider skills and capacity through access to no-cost training, and then a lot of comprehensive partner communication and engagement, ensuring family voice, is elevated, that their providers and community partners have clear, consistent information on how to access and understand available services, and then the quality assurance and continuous improvement related to our work with working with you all as service providers. And so as we think about the future of CBH, and CBHS services and supports, children and families are really central to, the work that we have moving forward, and then really surrounding them, with a process through which, they can feel supported to access the right services, at the right time. And so, kind of starting with that single assessment process, which we'll talk about in a moment, and then, having care coordination, and then developing the high fidelity wraparound, all of those services, kind of being able to wrap around a family, and then all of our infrastructure and supports, through the workforce development, communication, quality assurance, infrastructure development rules, and engagement to really, create this structure that really supports, children and families having the services they need when they need them. And so, talking through a little bit of our timeline and milestones, within that first year, I already noted that we're building that foundation. We've hired our principal settlement manager, although in the agreement it's called the integration coordinator. So that's Karen. We have finalized our implementation plan, and so we do have that posted up on our CBHS website. If you have not seen it, we can likely post a link to the chat momentarily, so you can take a look at that. We have been working with our partners at MainCare, with all of the rules that to be updated, to gain compliance with the agreement, a number of which are, currently posted, which you can certainly check out. And then building that single assessment process, our coordinated service plan, launching our engagement committee, as well. And so as we look to the future, we are in that early implementation. And so we recognize that, the agreement and all the work that we're doing, it's going to take time to really have, the influence, that we're, really, planning for and hoping for, and supporting, our service delivery system. And so as we're, moving into the early implementation phase, we're working on our data, collection and analysis plan, which I think was maybe just recently posted to our website as well. I'm not sure if it's actually gotten up onto the, if it's been published yet or not on the website. I see Karen nodding. So, we have that available too. So again, we can get some links out to that. And you can take a look at, all of the, data that we're going to be, taking a look at and how we're planning to collect and analyze that. All the rules that we're hoping to promulgate that I already noted, launching the single assessment, which is coming right around the corner in early February. And then training case managers and wraparound planning principles. And so, not only are we, updating the kind of assessment or referral process for medium to high intensity services, but then also to, work to train, our case managers and care coordinators, in those wraparound planning principles. Which has already, begun. I know a number of you have had, your team already, participating, in that work, which we're very appreciative of. And so we're moving right along on that, and then as we move into year 3 and beyond, we're really getting into that full implementation stage, looking at the system enhancements, and then, really monitoring our plan and, updating and refining, kind of as needed, and really using that lens of, kind of continuous improvement as we're, kind of moving forward. So within the agreement, we do have that goal, as we've noted, of supporting children remaining in their home. And so within the settlement agreement, it does prioritize the timely access to appropriate community-based services. And, what we've really, kind of looked at in terms of how we, our system has currently been functioning is that there are some inconsistent eligibility decisions that have contributed to delays and, the potential of unnecessary out-of-home placements. For an example, if a child's on a wait list for a service, let's say, HCT, and, things continue to progress and get worse for the child because they haven't had access to that service. It's just kind of one example. And so what we're looking to do is develop a single assessment, process which really streamlines and brings together a single consistent statewide approach, to determining, kind of service needs, utilizing a standardized instrument for assessing level of care. And it's really for those medium to high intensity services. And so the process Karen will, kind of talk about, kind of momentarily, but, really, the services that we're really focused on. And, we've got this little graphic here, and I'm sure it may not be super easy to read, on your screens, but, I imagine the slides will be able to be made available and you could take a look. But, looking at, Section 28 services, rehabilitative community support, kind of on the lower end, all the way up through, residential care on the higher end, and a variety of services, kind of in between. And so, the plan is that, as a child is recognized, through their family, through community service providers, through schools, or if you're connected with Department of Corrections and Juvenile Justice, JCCOs, can really make recommendations for, the child to be assessed, to be connected to an appropriate, clinically appropriate medium to high intensity service. And again, recognizing that the services aren't going to be necessarily available right away. The assessment process itself doesn't create new service providers, but what it does is it, assures that, the services that the, families are referred for, that they understand what they are, that they want those services. And so And then we'll be able to collect that data on that in terms of, and feel really good about the reliability of the, family being on, being referred for those services. So that way we can, really use a data-informed approach to say, here's where we need to invest, and here's where we need to focus on developing, additional services. And so with that, I think I'm going to pass it over to Karen.
Sorry, I'm just trying to find the unmute button. Hi, everybody. Thank you, Dean. So yeah, the single assessment, which everybody's been talking about, will launch on February 2nd. And as Dean said, this is going to become that statewide process for determining eligibility for all of those medium and high intensity behavioral health services. So we are we're moving upstream, and we are going to reduce sort of referrals to everything based on need, and try to align a child's level of care with the services that they will be referred to. It's also going to collect incredibly important information for us about what the needs are, and will help support future planning and strategic planning and service planning going forward. Because right now we have a lot of waiting lists, and we have a lot of access issues, but we actually don't really know what is going on in terms of what children really need, what families want to engage with, and what the services are that are out there. And so this will be another way of helping us align the needs and the supply. Next slide, please, Dean. So these are the key features of the single assessment. So what it is that to determine eligibility for any one of those medium or high intensity services, there's a starting point, which is a level of care assessment that will determine whether a child is eligible, and will based on their level of need. This is submitted, and a request for a single assessment should be made anytime a child is recommended for an out-of-home placement or one of these high or medium intensity services, or the child or the family in particular seeks assistance to help with a behavior that would indicate one of these high or medium services. The people who should submit a single assessment, there's going to be two paths, and I did see somebody ask in the chat, how do you get a referral? So any BH provider who has an Atrezzo account will request a single assessment through the Atrezzo portal. Everybody else, including medical providers, ED providers, families themselves, school staff, and we're going to be talking to the Department of Education to figure out the best way to get the information to them. They're going to use an external referral link that's going to be managed through CBHS program staff. We are going to set up what we're calling a single assessment support request form. This is just, we don't want to suggest that is actually the single assessment, but we're going to ask families, it's a very simple, like 2 or 3 questions, like a single assessment, here's my relationship to the child, and then somebody from the CBHS department, one of the program coordinators, will contact the referent and help them fill out the single assessment request form, again, which is simple. Everything we have tried to do, it's famous last words, is to really minimize administrative burden. So these will be, half a dozen questions just to get the information to Acentra so that they can start the single assessment process. Next slide. So once the single assessment is completed, and I should have put this slide in, but the single assessment actually entails the request is submitted. There will be, the referent will have to indicate what the events or behaviors are that is driving the person to want a single assessment and feels that they need one of these medium or high intensity services. And once that is complete, Acentra will connect with both the referent and then also the guardian or the family member, and they will gather information either from the referent, or they will already have this in their system, get the information they need, and schedule an assessment meeting. The guardian has to be at that meeting. The child should be at that meeting. We understand a lot of times children don't end up being at the meetings, but we are really going to, we're going to be actually checking if the child are at these meetings, but they should also be there. They will do the assessment meeting with all of the supports, the providers, whoever the family, has as their sort of natural team. And then 2 days after the completion of the assessment meeting, they are going to conduct a readout meeting. And so the readout, at the readout meeting, the Acentra, who will be licensed clinicians, will provide the family with their clinical recommendations based on the assessment and the level of care need. The family then will take that information. We've got a family-friendly sheet and a family-friendly handout. They will also get service descriptions, one-page service descriptions for each of the services that have been identified as being clinically indicated. And then the goal is to have the family meet with their case manager or care coordinator and begin the sort of service planning process. And this is where the second requirement in the agreement that is really foundational to all of the work that we're going to be doing going forward, which is they take the results of that information, the case manager, care coordinator, this is TCM, BHH, whoever is that designated sort of coordinator, and they're going to work with the family to identify which services the family would like to engage with, which family they think makes sense for them. The care coordinator then will use a structured questionnaire within the Atrezzo system. So if there are care coordinators on the call, they will know what questionnaires mean, but it's really a lot of series of click boxes. And they will enter in what are the services that the family has chosen, what's the provider that they want to work with. And I will also say, other than CRCF, eligibility from a single assessment, that is an automatic prior auth approval. So providers, there's a whole other process, but the providers will not have to submit additional paperwork. They can go in and they will be able to be approved for those services as the referral gets through. The goal is that this is not, and this I also want to emphasize, this does not replace any clinical service plans, or any kind of sort of treatment plans. This sits on top of that as sort of a view of the landscape for this child, for all of the services that they've chosen. They will then, the care coordinator will then do follow-up CSPs. They will, every time they go in for their continuing stay reviews, they will update information about whether the child accessed the service, if they're in service, how, based on the notes or whatever from the provider, if they're making progress. And they will also document if this child either has chosen not to elect a service they were recommended or can't get access to it. And again, we're both looking at sort of the individual level and the service planning for the individual, but then also using this to develop a picture of the population and where to identify where those service gaps really are and what is really going on. So that is sort of what the CSP is. Next slide, please. So why this matters. Again, this gives us a single organized view of eligible and selected services. It sort of coordinates that access and family-centered service planning. One of the other things that is critical and another key part of the agreement itself is family informed choice. And so there'll be documented the family engaged in this decision, and they chose these services, whichever they were, including an out-of-home placement. I will say that just because families may be eligible for community services, they may not elect a community service. They may still want to go forward. And there are a few more things that if in fact they still do want access, still do want admission for a CRCF, they'll have to submit a few other pieces of information. Again, as I said, this is going to track service access, progress, and barriers, and will inform that system level planning and capacity needs. Next slide. I'm not sure where we are now. Yes, okay, so there we go. I know. So So I know that was really fast. I will say there are trainings for care coordinators, case managers throughout the month of January, as well as non-care coordinators and case managers for other providers from Essentra, and we can send those along. People can join and listen. They will be recorded as well. And this is more the nitty-gritty of, you know, the details of submitting a single assessment through Atrezzo, but then also, you know, some other details for providers. Thank you.
So definitely open to any questions. I see that there's one in the chat, and Rhonda, thank you. I was typing a response, so I figure I'll just address it here. And yeah, and thanks, Karen. You know, this is up to age 21, and so Children's Services and, you know, the, you know, under Medicaid rule, vital care / EPSTT requirements are up to age 21. The agreement is up to age 21. But that said, you know, these are children's services, and the focus is children's services. And so at, you know, 18 plus, you know, an individual can elect adult services. And so, you know, community integration, you know, Adult Act, you know, those types of services would not be subject to the agreement or this process. It's really focused on children's services. But for anyone who's looking to seek those services up to age 21, they have that ability. And we'll go through this process.
Thank you both. Are there any other questions? Okay. Well, thank you very much. Oh, I see Sharon.
Hi, good morning. I was just listening in, and I do plan to take the training for, you know, the single assessment and all of that, and I think there'll be some good things that come out of that. I did want to just make a mention because I think like one of the things is that, you know, definitely enhancing kids' access and, you know, better tools to place people are great. I do, you know, on the provider hat, like paperwork is just completely overwhelming. And I think that it is, you know, I think about myself being a social worker, and, you know, when you spend about a good, you know, 60 to 75% of your time doing paperwork and administrative type of duties, it's very hard, you know, like it's really like you're moving away from what you really got in the field for. So I wondered, like, has it said that the coordinated service plan does not replace your care plan, your plan of care in children's services? So I feel like, you know, it feels sort of duplicative in a way. I mean, if you're a case manager, home care coordinator, and why couldn't they be the same? You know, like, could that be used as your plan of care as well, just to make it more streamlined and support? I don't know. I haven't seen the actual form, so I don't know if it meets all the requirements, but it just feels like it's like, oh my goodness, one more piece that has almost like the same things. I've always been an advocate. It's like, MaineCare, just give us the forms you want us to use, and they'll speak the languages that you need us to hit, and it reduces administrative burden. We will get the forms, we will do them, but when there's 4 or 5 different things that are kind of like the same, it really, and families do not want to sit and just do paperwork. They want service.
Right.
And I speak as a parent of a child with special needs, and a ex-foster parent. You know, the paperwork is overwhelming for people. They want services, not paperwork.
Totally understand. And I will say that I believe that as well. I think that, so we did design this with that in mind. So what this is it sits on top of a care plan. It is clicks. It's all clicks. You're not writing any new narrative. And I think that the challenge is that the coordinated service plan, it's called the individualized service plan in the agreement itself. It actually anticipates bringing in information about every single service, not just your service. So your ISP or your treatment plan is about the work you are doing, the individual. The care coordinator or case manager has to actually, we need the document to sort of knit everything together. And so we were challenged to figure out, like, how do we do this in a way that minimizes burden? And so if you've worked, I mean, I'm assuming you've been in the Atrezzo system then. So in the Atrezzo system, they have these things called questionnaires. And it's literally, you attach it to your service plan and you're going to answer a series of questions. So it's going to say, like, if your single assessment said, the child is eligible for, I am making this up, people, HCT and FFT, right? And so there's a question, what were the things, you click off those two things, there's a series of questions associated. So it's sort of all these clicks, which is not great, I get it. And then that is what, and then that just sits on top of the care plan you're going to upload. The one thing I might say, and I really don't, we'll have to see, is one of the things that we had hoped to get away from is the request for the single assessment itself within Atrezzo, even without it, is pretty minimal. And Acentra has assured us they will get documentation and support from their own system. And so insofar as care coordinators, case managers don't actually have to upload 1,000 things to determine eligibility, because now eligibility will be determined by a licensed clinician. There is the plan that will reduce the upfront administrative burden. I was told when I first started by someone that as a case manager, care coordinator, they could spend days just gathering people. That should be going away, or that should be significantly reduced. Again, because of the staff at, who are going to be doing these assessments, who are clinicians, have whatever's in the Acentra system as background, and we'll be doing these clinical interviews.
Yeah, thank you for that explanation.
We're trying.
And, but if that could keep that in mind, because my understanding of a care coordinator is, yes, it does describe, what the care coordinator is doing, but it also pulls together like pieces of like that wraparound view and like in the different domains. So it'd be nice if we could just have a good document that, and it doesn't have to be two, but we'll just use that if it can be enhanced. And become our plan.
And certainly one of the things that we're doing after we launch is
Karen, I'm sorry. I'm just conscious of time.
Okay.
And we do want to make sure we have the breakouts, and then we want to have space for public comment. But I wonder if maybe you and Sharon could connect separately.
Absolutely, please.
Others to bring back to us.
Thank you. Yep, 100%.
Yeah, that's good. I can do that. I have a lot to say about paperwork.
Okay.
Thank you. And I saw that Kayla just included a reminder around the breakout room topics. Again, they're care coordination and community health worker services, rate system subcommittee recommendations for the 2026 rate determination schedule, and also the MAC public meeting and annual report planning. You'll see when Kayla opens up the rooms an option to join whichever one you want to join. And then we'll come back in about 15 minutes, which is a little less time than we had hoped, but we want to make sure we have space for any public comment at the end of the meeting.
I will just add, we are still going to have 20 minutes for the breakout rooms.
Oh, okay.
So we'll reconvene at 11:50 and we will have simultaneous public comment and survey open to try to make the best use of our time. I think that'll work.
Okay, thanks, Kayla.
Awesome. I'll send a 2-minute warning to the breakout rooms before we come back together.
And if you're not sure, if you're not seeing the breakout rooms, if you click, there's a place where you can click that says join breakout room, and then you can see them listed as well. And Kayla, is the meeting, the public comment and the annual report staying in this main space?
Yes.
Okay.
And if anyone is having trouble joining a breakout room, I can manually assign you if you want to chat me or you'd like to go. I can help you out with that.
Great. We'll just give folks another like 30 seconds to get where they want to go. I see people going into the rooms. And for those of you sticking here, so we're going to talk again, we're going to discuss the public comment and the public meeting and also the annual report planning. And I can highlight some of the things that were shared in the notes from last month. I was here for part of that conversation, but not the whole conversation. But I know some of you were here for the whole thing. And as Kayla mentioned earlier, like we already have a pretty public MAC meeting system in terms of we don't restrict people from providing feedback if they're not a MAC member. And also, we've take suggestions from people who are not MAC members for agenda items as well at times. Plus, people can participate whether or not they're a member in the subgroups. But we also want to make sure that we do have a robust public meeting where people can participate who don't normally come to the meetings and to share concerns, things they'd like to see more of, whatever those things are. So, all of that is to say that we had some of this conversation last month, and I had to open a second ago. Hold on one second. Here again are the notes from last time. Oops. And as Kayla mentioned earlier, the notes from this are on the top of page 3 of the PDF. So we talked about, it sounded like there was consensus for people to have some sort of hybrid version where there's both virtual and in-person options. Thinking about physical location options, it sounds like Augusta, Bangor, and Southern Maine were discussed. We were thinking mid-spring would be preferable because it's after most of the weather barriers. Also, summer is always a hard time of year for people to engage, and we need to do it before July in order to meet our 2 times a year for this current round. There was discussion around having members be able to provide opening remarks, presentation of public feedback themes, maybe themed breakout discussions, so access, providers, dental, etc. Then a public comment period and a closing summary. There's also an idea for the people who are in person to maybe have networking time and light refreshments. We could probably have networking time for the people virtual as well, though that's a little more challenging. And also being able to have plain language invitations and prompts for public input, making sure we get it shared out with partner groups like Maine Parent Federation and advocacy organizations, so we have a broad range of people joining. Sorry, I have this cough that won't quit. So before we talk about the specifics of like how can we make these things happen, does anyone have any additional thoughts that they want to lift up or like concepts that they want to make sure get captured while I try to stop coughing? Should we narrow in on just terms of thinking about logistics? Should we narrow in on the physical location and trying to think about what makes the most sense for this first public meeting?
I think that would be great. And I think that's a good opportunity for us to also highlight the state and like how we can help with that and what our limitations might be with that.
Yeah. I guess I was thinking that maybe for this first meeting, it would make sense to try to do it in Augusta because there are multiple spaces that we could potentially use through the state. And that might just be an easier lift for this first time. And then depending how that goes, we could decide whether we want to do the next one in a different location.
Are we thinking this would be during the daytime or after work hours?
That
I
is,
wasn't in the group the last time, so.
yeah, that's a good question. I wasn't here for that part of the conversation, so I'm not sure. Do folks have strong thoughts about it?
I was just assuming it would be the normal MAC meeting time, but it does not have to be. We could do a survey or ask the group somehow.
I mean, I just wonder if like later afternoon would be easier for people who work or for parents whose children are receiving main care or something.
Yeah,
Because I think
I
10
always feel
a.m.
like
in the
it's so
morning.
hard because, like, for some people, later is better for sure, and for some people, it's not, depending on work schedules and childcare.
I mean, the flip side is I know there was something about a hybrid meeting, but I almost wonder if it would make sense to do two separate ones, like an in-person during the day and a virtual one in the evening to get both populations.
That's an interesting idea. I wonder, just logistically, my brain, of course, is going to the requirements we have to meet for the MAC meetings, which is very separate and distinct from what might make the best MAC meeting. So acknowledging that, but thinking through, like, would we have the same agenda, do you think, for both of those meetings? And should we have a mechanism for cluing in, like, whoever went to one meeting, what the folks at the other meeting talked about? How would that look, do you think?
Yeah, I mean, I think a little bit about the public meeting. They weren't public meetings in the sense of trying to get such a broad range of people, but the meetings that we had, like when we were doing the dental benefit and trying to get feedback from providers and people who use the benefit. And we ended up, I believe it was main care was holding them, not the MAC, but I believe they were held, like some were held at like lunchtime and some were held in the evening. In that case, we just provided opportunity there was like a brief presentation from main care, which I think we could do a similar thing for these meetings, like about what's the purpose or whatever. But then just opened it up for people to share whatever they wanted to share. And then ultimately, like the notes all got compiled so that we could see the notes. I can't remember exactly how that worked, but we could probably figure out something like that if we wanted to do 2 times.
The other thing that I would just add is that whether we do a hybrid meeting or 2 separate, a virtual and an IRL meeting, to however that works out, to determine the dates as soon as possible, because it would be necessary to include ASL interpreters, and those are difficult to book. And if it's a hybrid meeting, figuring out how the interpreting takes place for the people in the room versus online. So there are some accessibility considerations that I think, need to be considered.
Yeah, fair. I had a similar question too. I was wondering about ASL interpretation, but also if there was a mechanism to find out if somebody who speaks another language needed interpretation. And like we could ask as part of the registration if people need those supports, but I also was wondering if we can accept written comment, because that could also allow some folks who might not be able to participate to share their thoughts. And for some people, that might be an easier way to share their thoughts than speaking in front of others.
Yeah, I am a fan of that idea. That's what we're going to do today. It's both written and verbal.
Yeah.
I'm wondering, do you think just open comments, or should we have themes like that we are requesting comment on, or both?
Both.
Yeah.
I almost go with both, just thinking in terms of wanting to make it the most accessible and broadest means of getting input from the public, because I think if we just said themes, people are going to self-select out of participating, and I don't think we want to do that.
Yeah, we could make it clear that there's like, you can bring up any issue related to MaineCare. Here are some potential topics for you to think about, but they're not the required topics.
So as I think you're going to see, my brain just works this way. I'm jumping right to, we received the public comment. What is going to happen with that? Is it going to go to the MAC for review, and then the MAC will decide what to pass on to the state, or the MAC will decide what will be a future meeting breakout topic, or submit some kind of formal letter or something to the state on behalf of the MAC? Will it be filtered through the MAC? That's kind of what I'm envisioning, but I think that's open for.
That's kind of what I was envisioning as well, Keela. And I guess part of my thought was maybe we could ask for like a subgroup that could help review the comments and who would be present for the comments in person.
Yeah.
And then we could, and virtually, and that committee could meet following the public meeting and then bring like, either they could make a proposal of like, here's the things we think might make the most sense in terms of how to address these issues. Because we need to compile, we're supposed to treat like it's kind of similar in a way to rulemaking. Like we're supposed to compile the comments, right? And respond to them in some way.
Yeah, the rule does not require a response.
Oh, okay.
But in the annual report, it does require us to explain how we used feedback. So I think that it could apply there. I would imagine not every comment in the annual report, but we'll want to take it.
I do think for, even if it's not required, it might, like if there are specific questions, like it might just be nice to be able to respond to them anyway, even if it's not required. Help, help people knowing that like their feedback is noticed and considered, or just have a question, here's the answer to it, basically. Yeah,
I think so, because a lot of times I think people are like, okay, so I submit the feedback, I do the survey, I whatever, so what? Like then what's the next step? So I think having some sort of just acknowledgement of whatever was contributed, and there might be a way to, depending on how much feedback is provided, to go through and sort of categorize the questions.
Yeah.
And just sort of address the overall themes. So you're not answering like 150 questions individually, but maybe breaking them up into certain sections about, general, whatever, and then maybe a resource to get more information.
Great idea, Sarah.
You could always do something like table talks, which is kind of like you go to a certain area and you talk about things with your group, and you kind of brainstorm a little bit and come back to the group with some questions that you've settled on, and then produce those as those voices. So like if you had 5 people at a table and they all had a question about dental or had an issue about dental, then they bring that back to the larger group, and that would be something that would help guide our decisions or guide our work. Just a suggestion.
Yeah. Also just noting, Sarah Lewis sent me a message, but I think she maybe sent it to everyone, wondering about whether we should have language specific focus groups or breakout groups. And I think that is a good idea. I think it depends on how many people might attend, where language would be a barrier.
Yeah, I'm thinking Somali and Arabic, and I'm thinking critical mass. I agree with you. Like it's got to be not worth it, but like it's like a lot of effort. But as Maine Access Immigrant Network on the MAC,
yeah,
I feel like that's something I could contribute is to help organize those. And by those, I mean reaching out to key folks where I know they have standing meetings and ask if one of those standing meetings could be led by a MAC member or someone from the state to do this, to do a focus group that is led in English and interpreted, but the odd person out is the English speaker and the entire room is Arabic speaking. And therefore more riffing happens, more, oh my gosh, yes, I was going to ask that question in Arabic. Well, you've got Sana Osman. She's going to kill me for signing her up. But she could help with that for sure. And I'm thinking, am I thinking regionally, that's going to be mostly like Southern Maine, even though we have folks building lives in mid to Northern Maine. We could at least get, a certain number of people. I think we would just need to know what would be the goal to make it worthwhile. But I'm thinking in terms of MaineCare, it's mostly in our world, it would be certain language groups, honestly, because that's sometimes, it's pretty closely correlated to immigration status and what they qualify for. So I'm just thinking, like, in terms of finding a general area of people to question and get their feedback on.
And yeah, I think that having it part of registration would really help us determine whether or not we need to have an interpreter. But we also need to think about time. We need to book these folks. We need to arrange everything. We need to know which languages, stuff like that. So, I mean, on registration, if we have it in advance, like a good amount of time in advance, we should be able to coordinate that. But I don't know, I'm a little nervous about just sending out a regular survey. So I think part of a registration would be best.
Yeah. I love your idea, Sarah, about trying to like figure out a way to have enough people participate that there is like a language that people can speak in and communicate together with. I wonder, just since this will be our first time trying to do the big public meeting, if it would make sense for this time to not be quite as ambitious and have like the question around, like, during registration, do you need an interpreter for this one? And less like meet individual needs. But then once we've learned how this goes, we could then think about a different way to do the one, because we're going to want to do another one next year. Next year being like starting in July through June, right? So it's not calendar year, it's the July to June year. So I see Kayla saying we're running out of time, we're gonna close. I wonder if it would make sense for like a small group of us to try to get together in February to make a little more concrete plans with a little more time. And we could open that up to the larger group as well. If people are willing to do that. Welcome back, folks. Oh, it looks like we lost some people, or maybe some people haven't come back.
I think it gives 60 seconds before it like forces everyone back.
Well, hopefully it felt like you had some good conversations. I know there wasn't really enough time, so time is always a challenge. Here comes some more people. Welcome back, folks. So one thing I wanted to just name from those, there were folks from MaineCare in each of the breakout groups who were taking notes. So we'll have a chance to, again, loop back and follow up with anything that needs to be followed up with. And then also just naming out loud that, hold on one second. Sorry, my computer was doing something weird. I also just wanted to name that the group that was meeting around the public meeting that will be later this spring, and then also a plan around our annual report that we now have to do as part of the access rule. We suggested that we could hold like anybody who's interested in helping to plan that. We could try to hold a meeting in February with a little more time because we didn't really have enough time today to get into all the details. So I will share that in the follow-up from this meeting. And if anyone is with a doodle and if anyone's interested, you can do the doodle and join us in February. And then I also just wanted to note that we do want to take time during these last 8 minutes of the meeting for anybody who does have issues that they'd like to raise that we haven't discussed in the MAC. You can do that using the public comment form that Kayla just put in the chat. Or if you'd like, you can raise your hand and we'll have you come off mute and you can share your information. I also just want to note that Laura shared the rate system subcommittee meeting information in the chat in case you're looking for that. Kayla, is there anything else you want to say about the public comment?
I don't think so. We'll see how it goes. I am also going to simultaneously be launching a poll to get feedback on today's meeting.
Oh, right.
So feel free to do that during this time as well.
Yes. So here's the poll that just got launched. And if you could go ahead and complete that as well, that would be really helpful information for us. And again, if you have something you'd like to share, concern, something you would like to see more of, a topic that you want to have the MAC focus on, something you want to bring to MaineCare's attention, now is a chance if you'd like to raise your hand or use the public comment form. Okay, I'm going to go because I do have one thing I would like to lift up as an ongoing question, I think, for the MAC, which is this has come up periodically during legislative sessions and when budgets are being considered. And I know that there are like challenges for staff in the department to share details about what's being considered, for example, for the budget. And there's concerns about legislation sometimes being shared before it's made public. But I would like us at some point to think more again about like what is the role of the MAC and the BAC in advising the department around legislation that is relevant to MaineCare. Because it feels like that's a question that's come up multiple times over the years and just we never seem to totally figure out a way to resolve it. And to be clear, I was thinking about department or administration created legislation. I know there's lots of bills that touch on MaineCare that come from lots of different places. I don't expect the MAC to weigh in on everything, but just wondering like what is the role for the MAC or the BAC in providing that kind of feedback around potential legislation coming from the department. Does anyone else have any comments that they'd like to make before we close the meeting?
I will
Okay.
say thank you to the 17 people who have taken the poll.
And if you haven't yet, please feel free to. I also just want to note for our public meeting, the next time we're going to do the open public comment space, that group that was talking also discussed about having like some suggested topics available. People wouldn't have to comment based on the topics suggested, but just thinking that having some suggestions of things that have come up a lot might be helpful as a starting place for folks to think about. All right, well, not seeing anyone else wanting to make comments, so thank you all for your input and participation. I'll follow up with the links that were shared and a doodle for that February planning meeting for folks who are interested. And thank you all.
Thank you. Nice to see you all. Thanks, Kathy. Thank you.